Baldwin County hospitals are seeing a significant drop in COVID-19 hospitalizations over the last 30 days. Infirmary Health, which operates North Baldwin Infirmary and Thomas Hospital, is reporting 75% fewer hospitalizations this week. During the last week in August, those numbers were still climbing. South Baldwin Regional Medical Center in Foley reporting 19 COVID-19 hospitalizations today. That's compared to 51 back on August 23rd. Today, we caught up with the president of North Baldwin Infirmary about the latest trends.
Back in August, we had the worst peak that we have seen in the COVID pandemic thus far. We thought January was hard. Here at North Baldwin Infirmary, our peak in January was around 12 to 15 COVID positive patients. In August, North Baldwin Infirmary actually had 27. That's almost half of our total bed capacity in this hospital.
While the news is encouraging, he's not celebrating just yet. Infirmary Health continues to monitor the virus, but hospital officials say things are definitely looking up for now.
And Alabama's state health officer says progress is being made in the fight against COVID. But as state Capitol reporter Jeff Sanders reports, he does acknowledge also the devastating toll the virus is still leaving on the state.
Dr. Scott Harris says while he's optimistic over increased vaccinations, he's frustrated and saddened over daily death rates.
123, 133, 205 people, 250 people, 161 people, 192 people. And you know, these aren't numbers or stats. These are our friends and our family and our loved ones. These are Alabamians who are dying of COVID.
The grim daily count of just the last few days in Alabama's hospitals.
At least 90% of these deaths are completely preventable with vaccination. There is no reason that these people should have had to die.
Harris says his office is working to confirm that Alabama leads the nation in the percentage of daily COVID deaths. He also addressed confusion surrounding the FDA and CDC's guidance on vaccine booster shots.
Going to be really hard to communicate. You know, that's not a great soundbite that you can put out there. It's going to take a little bit of digging into for people to understand.
Harris says there is still a shortage of monoclonal antibody treatments allotted from the federal government. He also responded to criticism the state should bypass the federal government and buy straight from the manufacturer.
That is an option if we have access, to funds to do that. I guess that could be an option. We don't have access to funding to do that at this point, but many of the providers are doing that. I know hospitals here in Montgomery, for example, have been buying that just directly from the manufacturer.
And since the beginning of the pandemic back in March of 2020, nearly 14,000 Alabamians have died from the virus. Reporting from the state capitol in Montgomery, Jeff Sanders, WKRG News 5.